Today's topic is rectum and anal canal. The meaning of the word rectum is rectum means straight. Rectus, कौन से मसल है? Rectus abdominis, then rectus femoris, straight. Anything else? Vasa recti. So rectum means straight. Now it is straight in lower animals. Lower animals ऐसे अगर है और उनका terminal part which is rectum in any lower animal, it is straight because it is horizontal. So सारे animals में rectum is straight, but it is horizontal because animals are four-legged. Human beings, the rectum is not straight because human beings are straight. Because हम लोग ये vertical position में होते हैं and there is something called as gravity which acts on everything in the body, and that is the reason rectum is not straight in human beings, because a person would have been using the toilet 10 times in a day if the rectum would have been straight. So to avoid the stool coming down, sagging down due to gravity, the rectum is not straight in human beings, and for that reason the rectum has two antero-posterior curvatures and three side-to-side curvatures. Okay, two antero-posterior and three side-to-side curvatures. The antero-posterior curvatures are like this. If this is the sacrum, rectum extends from S3 downwards, junction between S2 and S3. From there on downwards, the rectum extends. So the first antero-posterior curvature is concave. First antero-posterior curvature is concave, and next is convex. And moment it becomes convex, it immediately starts continuing as anal canal. So rectum, the extent of the rectum is from S3 onwards and 1 to 2 centimeters ahead and below the tip of coccyx. Okay, that's the extent of rectum. S3 and 1 to 2 centimeter ahead, anterior and below the coccyx, from where it continues down as anal canal. So first antero-posterior curvature is concave, second is convex, and then there are side-to-side curvatures. The first side-to-side curvature is to right, the second is to left, and third is again to the right. And then it continues down as anal canal. Okay, so this is the first to the right, this is first, second to the left, and this is second to the right. Okay, 1, 2 and 3. There are 3 curvatures. Light बंद करना है. ये लो ये वाला. So you understood the curvatures of the rectum, right? 2 antero-posterior and 3 side-to-side curvatures. Now on we'll begin the class at 8:15 only. The next few classes, okay. No need to come running at 8 o'clock. Yeah. So now, how rectum is different from the other parts of the large intestine? Rectum does not have the classical features which the large intestine has. What are they? Hostrations, tinea coli, appendices, epiploic. They are absent in the rectum. These are the three differences between small intestine and large intestine, but these three are absent in rectum. Okay, they don't have these classical features. Now talking about the relations of the rectum. The rectum, when we write the relations of any abdominal organ, firstly we write the peritoneal relations, right? Now if this is the rectum, we are looking from the side. The rectum is covered by peritoneum anteriorly and on the sides in upper 1/3. In upper 1/3 it is covered by anteriorly and by the sides. In middle 1/3 it is covered only anteriorly. Middle 1/3 covered by peritoneum only anteriorly. In upper 1/3 anteriorly and side, and in middle 1/3 only anteriorly. Lower 1/3 of it is not related to peritoneum, not covered by peritoneum. Okay, so this is upper 1/3, this is middle 1/3, and this is lower 1/3. Lower 1/3 is not covered by peritoneum. क्या बोले? अच्छा, clear? So that's the peritoneal relation. Now we talk about the visceral relations. Visceral relations, we talk about the anterior relations and the posterior relations. Anterior relations, यहाँ पे in females it will be related to the recto-uterine pouch in the upper 2/3. So कोई भी relation आप rectum के लिख रहे हो, you have to write in upper 2/3, in lower 1/3, in male, in female. Okay, दोनों में अलग अलग रहता है, upper 1/3 और lower, upper 2/3 and lower 1/3. Now let us talk about upper 2/3 in male. It will be related to recto-vesical pouch. It will be related to recto-vesical pouch. Okay, in upper 1/3. Recto-vesical pouch में क्या रहता है? Coils of ileum. Coils of ileum. Now lower 1/3. देखो, now this is the rectum, this is the pouch. Here the rectum turns like this, pouch goes like this above the urinary bladder. Here is the urinary bladder. So lower 1/3 will be related to prostate. Lower 1/3 will be related to prostate. What is there behind the prostate? Seminal vesicles, ejaculatory duct. So lower 1/3 is related to posterior surface of prostate, seminal vesicles, ejaculatory duct. This relation, children, is very important because in a per rectal examination is done to feel the prostatic enlargement. अभी प्रोस्टेट को कहाँ से एक्सेस मिलेगा? अगर आप किसी गांव में हो जहाँ पे यूएसजी नहीं है, कुछ नहीं है, एंड अ मेल कम्स टू यू, elderly male, and he says that he is not able to pass urine properly, small amounts only. So then to check whether there is prostatic enlargement, we do a per rectal examination. If the prostate is enlarged, a person is able to feel the prostate through the rectum. So the anterior wall of the rectum. हम लोग बोलते हैं ना ये रिलेशंस क्यों सिखा रहे हैं, इसके लिए सिखा रहे हैं. ओके, सो पर रेक्टल एग्जामिनेशन, एंटीरियर वॉल पे वी फील फॉर अ firm swelling, and if a huge swelling is there, that means the prostate is enlarged. So anterior relation, we are talking about लोअर 1/3. अपर 1/3 मैंने ऑलरेडी आपको बताया. नाउ फीमेल्स, अपर 2/3 विल बी विच पाउच? रेक्टो यूटेराइन पाउच. उसमें क्या रहेगा? कॉइल्स ऑफ इलियम. कॉइल्स ऑफ इलियम. Now lower 1/3 in case of females will be related to the lower part of vagina. Lower part of vagina. So in case of females, the vagina like this, and that means upper 2/3 is the pouch. Beyond the pouch will be cervix and upper part of vagina. Lower 1/3 will be related directly to the lower part of vagina. तो यहाँ पे एक कभी कभी कॉम्प्लिकेशन होता है recto-vaginal fistula, and that is the most horrible thing that can happen to a female, because this is highly infective and it is going into a sterile area, vagina. So again and again the female will keep on getting infections because bacteria from the rectum are going and infecting the vagina. So these are the anterior relations. Clear? Upper 2/3 में pouches, lower 1/3 में males में क्या? Prostrate seminal vesicles, and females में lower 1/3 में lower part of vagina. Because these seminal vesicles are there just anterior to the lower part of the rectum. Okay, so then what happens is, if a person remains constipation, male person remains constipated, has major issues in passing stool, such a person may also complain of nocturnal discharge of the semen, because that rectum, when it becomes full, it will just press upon the seminal vesicles. Okay, so you will come across patients like this. They come and they say that they are getting nocturnal discharge of the semen. So one of the aspect is keeping good bowel habits. Okay, so such people, they are told that we give them laxative and ensure that before going to bed they use the washroom, they pass stool, so bowels are clear. Okay, bowels are not clear, they don't clear the bowels in the night, already there is constipation, stool there, again the food what he has eaten adds to more stool, and that just okay. So now we talk about the posterior relations. So for posterior relations I have already drawn a diagram for you. ये क्या था? Sacrum, right? Which level was this? S3, and the rectum was going like this. तो एक posterior relation तो आपको मालूम है क्या है? Lower 3 pieces of sacrum, then coccyx, anococcygeal ligament. Lower 3 pieces of sacrum, right? Coccyx and anococcygeal ligament. Okay, बाकी का जो रिलेशंस है आपको सेक्रम सिखाया है. स्मॉल, सॉरी रॉन्ग क्वेश्चन पूछ रहा हूँ, बट सिखाया है डेमो में. सो जो भी सेक्रम के रिलेशंस है लोअर 3 पीसेस में, वो इसके पोस्टीरियर रिलेशन है. तो उसमें से क्या रहेगा? एक तो ये मसल, कौन सा मसल है रे? ये पायरिफॉर्मिस, राइट? सो दैट विल बी वन रिलेशन. देन क्या है? ऐसे एक दूसरे से यूनाइट हो रहे. सिंपैथेटिक चेन यूनाइटिंग एट ganglion impar. Two sympathetic chains uniting at ganglion impar. बस हो गया, इतना लिखा आपने. Lower three pieces of sacrum, piriformis muscle, two sympathetic chains यूनाइटिंग एट गैंग्लियन इम्पार. 4 रिलेशंस लिखेंगे. एग्जामिनर आपका पेपर लेके नाचेगा कि ये कौन सा स्टूडेंट है, इतना लिखा उसने. पहले तो उसने रेक्टम का क्वेश्चन अटेम्प्ट किया. ओके, नाउ ब्लड सप्लाई ऑफ द रेक्टम. नाउ रेक्टम का जो ब्लड सप्लाई है ना, that comes from superior rectal artery, mainly from the superior rectal artery. Superior rectal artery is a continuation of inferior mesenteric artery. I am so happy आपने आंसर. inferior mesenteric artery. फिर बाकी आर्टरीज है, मिडल रेक्टल, इंफीरियर रेक्टल, ऐसे भी 2 आर्टरीज है. these arteries they come from internal iliac. Internal iliac के the internal pudendal that gives then inferior rectal artery. Okay, so they come from the internal iliac ultimately. They supply more of anal canal, जो middle inferior. middle थोड़ा सा rectum को भी supply करता है, inferior तो anal canal को supply. Venous drainage again is by superior rectal vein. Now what does superior rectal vein join? Superior rectal artery is a continuation of so superior rectal vein continues up and becomes inferior mesenteric vein, which joins the splenic vein, which joins the superior mesenteric vein to form portal. So superior rectal vein becomes inferior mesenteric vein and joins the splenic vein. Superior rectal vein becomes inferior mesenteric vein and joins the splenic vein. Okay, so rectum is not a site of portocaval anastomosis so much as compared to anal canal. Anal canal, which we are going to study now, it is a site for portocaval anastomosis. Rectum के arteries है, involved है, ये vein जो है ना, superior rectal vein, but the rectum is drained mainly by this vein, not by, which is part of portal, not so much by the other two, the inferior rectal vein and all. Okay, which is systemic. It is, but anal canal is more. Okay, the venous drainage will be by internal iliac. इधर pelvis में कुछ भी आपको venous drainage याद नहीं आया तो क्या लिखना है आपको? internal iliac lymph nodes. Okay, pelvis, every organ, parasympathetic supply is by S2, S3, S4. Nervi arrhyngtis, S2, S3, S4, parasympathetic supply. And the sensory supply is by S2, S3, S4, but internal pudendal के branches. Sorry, pudendal nerve के branches, not internal pudendal is art. Pudendal nerve के branches, S2, S3, S4. So sensory is by S2, S3, S4, but branches of pudendal nerve. Parasympathetic is by S2, S3, S4, but these are nervi arrhyngtis, which is a part of the craniosacral outflow. Sympathetic याद नहीं आया, L1, L2. Most of them is like this, L1, L2. Sympathetic. Parasympathetic, S2, S3, S4. Which is that nerve? Nervi arrhyngtis. And sensory? Okay. So development of the rectum is from the hindgut. and upper part of the cloaca. Some part develops from the cloaca. Okay. When we discuss the hindgut, right, we talked about this septum, urorectal septum. So this is rectum. We said behind is rectum. So what develops from it is rectum upper part, and from this is the hindgut. Rectum upper part develops from here, rectum lower part develops from the cloaca. So this originally was the cloaca. याद है आपको? Divided by urorectal septum into primitive urogenital sinus and rectum. Okay, so rectum lower part develops from this rectum, upper part develops from hindgut. So therefore they say कि functionally it has two parts. The upper part which develops from the hindgut is for storage of stools. In the lower part, when the stool appears, a person develops a desire for defecation. Applied anatomy of rectum. Applied anatomy of rectum, applied anatomy of anal canal, it will go together. Sometimes there is this septum, if it goes behind rectal stenosis. ये यूरोरेक्टल सेप्टम है, ये ऐसे डेवलप, जरा सा पीछे गया, ब्लैडर बड़ा है, रेक्टम छोटा, there will be rectal stenosis. This can lead to megacolon, congenital megacolon. One of the reasons. Other reasons of congenital megacolon is the absence of the plexus, which is there responsible for peristalsis. But this is also because the stool will not pass, so congenital megacolon. ये ऐसे सब बच्चों को हैंडल करना बहुत मुश्किल होता है. बच्चों को इन जनरल बड़ा करते हैं कैसे, आपको आपके पेरेंट्स ने स्टोरीज नहीं सुनाए रहेगा, बट इट इज़ अ होल एफर्ट. बच्चा स्टूल पास नहीं करता, एक दिन 2 दिन, उधर फादर मदर एंग्शियस, क्यों, तो स्टूल नहीं पास कर रहे, एक दूसरे को ऑफिस से फ़ोन करे, किया नहीं किया, अरे और टेंशन. तीसरे दिन वो स्टूल पास करते हैं तो सेलिब्रेशन, वो बाहर जाके फादर आइसक्रीम खा के आते, कुछ तो स्टूल पास किया बच्चे ने. Now, so that is congenital anomalies. 2. What is 2? Investigation. Proctoscopy. Proctoscopy. Next year, when you will go in the surgical posting, there is a proctoscope. Okay. Okay. So थांबा, आता मी शिकवतोय, सांगतो मी शेवटी. Proctoscopy. तो proctoscopy में again a scope is inserted in the rectum. It's a metal scope. लिग्नोकेन जेल लगा के उसको अंदर डालते हैं. Then you can actually see, छोटा सा रहता है, this long the scope. Proctoscopy. 3. Inflammation of the rectum, infection of the rectum is called as proctitis. Proctitis. Okay. Surgical, yes, for prostate enlargement, per rectal examination is done by the surgeons to check the enlargement of the prostate. And 5. Rectal cancer, very common. Again, in the Western world, क्यों बोलो, क्या रीज़न रहेगा? Consumption of fast food, non-fibrous food, non-vegetarian food also. मतलब वो है जो है, non-vegetarian excess food consumption, it can lead to colonic and rectal cancers. Okay.